Welcome back. It's time for Morning Rounds. Now, May is Urgent Care Awareness Month, and now is a good time to discuss how urgent care plays a factor in your health. Nurse practitioner Kelly Bryant joins us live over video chat this morning to share what we need to know. Good morning. How are we doing today?
Good morning. How are you?
So far, so good. So, just to start off with here, when should you go to an urgent care versus your primary care doctor?
So, urgent care and convenient care is primarily meant to be accessible and convenient for patients. So, we see a lot of the same symptoms that primary care providers do, but we see those on a same day basis. So, certainly, if you're not feeling well, if you have an injury that requires x rays, stitches, things like that, we can evaluate you. We do sports physicals as well. So, we have a wide range of capabilities here in convenient care and urgent care.
And there are certainly circumstances when you should actually consider your primary care physician over an urgent care. When should we actually be going to the doctor instead?
So you definitely want to go to a primary care provider to establish a good relationship with your primary care provider when you're managing long-term health conditions. If you have any school physicals, sports physicals, things like that, it would be good to just have a good rapport with your own primary care provider.
And when should we go to an urgent care versus an emergency room?
So really, emergency rooms need to be for life-threatening conditions only. Most of the time, urgent care can take care of anything that's not life-threatening. So like I said, if you need stitches, if you need x-rays, labs, or any kind of workup, it's totally reasonable to come to a convenient care or an urgent care. A lot of times we can do a large portion of the workup and at least guide your treatment plan to get you where you need to be, whether that's the emergency room in the end or that's a specialty that needs to evaluate you. But we take care of all kinds of things like colds and flus and sprained muscles and broken bones and stitches and flu, even COVID. We'll see you for symptoms for COVID here in this clinic.
Are there circumstances because of the COVID-19 pandemic right now where urgent cares are being inundated with a lot of patients?
So we do have a bit more respiratory patients, but we've had to get creative in how we see those patients to maintain a level of safety just for our staff and for other patients coming in. But yeah, we do see a bit more respiratory symptoms. Luckily, we're not seeing a lot of COVID right now, but a lot of the cold symptoms do mimic COVID.
And Kelly, when people are coming in, and what changes have actually come when it comes to pandemic and caring for some of those patients? How are you able to care for the patients now and give them the same care compared to pre-COVID?
So we do a lot of COVID screening questions. We do have one location in Champaign where our patients wait outside in their car so that we don't have a large group of patients in the waiting room within 6 feet of each other, kind of transferring germs around to each other. So we just kind of had to get creative for the waiting room aspect just to keep patients in their car versus in our waiting room. Everybody wears a mask. Every patient is required to wear a mask, and it's working.
And Kelly, a lot of people have anxiety about just going to the doctor, whether it's the emergency room or just going to see their primary care doctor as well. Can you tell me what kind of feeling it is to be able to provide this service with urgent care that kind of has that go-between that's, I guess, not quite so life-threatening and not quite so serious for a lot of those patients? That's going to be a good feeling.
Yeah, definitely. It's been really nice to be open throughout the whole pandemic and to be able to serve our community. And also, I'm always big into reassuring our patients that we're taking all the necessary precautions so that everybody is safe and everybody is staying healthy, and just letting them know that we're here for any question, any concern, pretty much any time.
And Kelly, if anybody has questions right now, what resources do you have that are available? How can they reach out to you?
You can certainly reach out to me through the Christie Clinic website. You can reach out to the Convenient Care Department. That's our phone number, 217-366-8130. If you have any questions, we always have a nurse that can kind of guide you to the correct location and let you know where it would be best for you to be seen.
All right, thank you so much for your time. We appreciate talking to you this week.
Thank you. Have a great day.
Thanks, you too. Jack has your forecast next. We'll be right back.